Every year we screen 4 million births to find 10,000 babies who require one or more diagnoses and action. But there are 2 million people out there in the US that have one of 3 genetic conditions.
Lynch syndrome,
Hereditary breast and ovarian cancer,
and familial hypercholesterolemia. Every one of them can be involved in something called cascade screening. And what do we mean by cascade screening?
Because we're talking about genetic conditions, they affect multiple family members. And so it's really important, once you identify a particular person in the family, to then look at the rest of their family, because we know that they're at much greater risk.
So if this person presents with the disease, it's an opportunity to go to the rest of the family and ask that each one of these people be checked. And again, the checking of these people is done in different ways in each of these different diseases. These other people may be pre-symptomatic. They may not have symptoms yet. In public health, this is really important. And of even greater benefit to public health is we can do it beyond the immediate family, to the children of the siblings, to the aunts and uncles, and so on throughout the family.
We estimate that somewhere around 1 out of 370 individuals in the general population has Lynch syndrome. 1 out of every 35 colon cancer patients has Lynch syndrome.
There's about 10 different cancers that are associated with it. So to actually diagnose that individual with the syndrome, you need a good detailed family history. So most cases are missed.
1 out of every 40 endometrial cancer patients has Lynch syndrome, and we estimate that less than 5% of them know it.
The next generation who haven't yet had cancer are just kind of waiting for it to happen to them.
The importance of treating people and identifying people with familial hypercholesterolemia is that A, it's a common genetic disease, that B, is treatable, and that C, by treating it, can prevent life-threatening events.
And right now, we have a tool that would save lives.
We need to educate more doctors and patients about these genetic applications, launch real-time cascade screening programs, and track the number of lives that we are saving and improving so we can learn how to help even more people.
Well, I think the biggest challenge is one, awareness. Awareness not only at the patient level, but at the provider level.
There's a real need for people to understand which of these tests have been shown to actually improve outcomes and save lives.
So if you sort of refer them for screening, well, a lot of times they don't know where to go, how to get it, how much it's going to cost, and so they just end up avoiding it.
But I also think another huge challenge has to do with policies and making sure that policies are in place that let us actually implement cascade screening in an appropriate and thoughtful way.
How do you get people to come together from across all these sectors who all have a desire to do this and then figure out how to do it effectively?
The idea that there are genetic applications that we can use to reduce the suffering from heart disease and cancer is an idea that whose time has come, really.
You have the opportunity to reach an enormous amount of people for relatively low cost and save lives.
And this would be something that we should put our energy, our resources into so that we are saving these lives.
I know we can diagnose every single person with Lynch syndrome, and I think it just is we're so close.
It's not very often that you really get an opportunity to make a difference, and it's kind of my deal with life that since I'm here and I survived my heart attack, that's what I'd like to do, is help other people to actually avoid having these early heart attacks or even dying prematurely.